Assalamu alaikum wa barakatuh. Thank you very much to be among you to describe the first published result of home hemodialysis in Saudi Arabia in Western region and Jeddah. We know this famous slide since long time that nowadays we have more than 3 million population on dialysis worldwide, and the prevalence of dialysis is going up on all over the country from the east to the west. In Saudi Arabia, the annual incidence about 136 patient per million population and the prevalence 513. And this is the last quote data, Saudi Center of Transplantation, very well known, who had the registry in the kingdom, and we found that we have about 271 dialysis center, and on yearly basis we have about new 4,000 to 5,000 new dialysis in the kingdom. Net increment per year about 6 to 7%. And this is the last picture. We have about more than 21,000 patients on dialysis. But we should know that over the years that the population age has changed. Before, in the 90s, we deal with the youngest patient. Nowadays, more than 50% of the population on dialysis more than 50 years, and we have some people about 10% more than 75 years. The etiology of intestinal disease doesn't change over the year, mainly diabetes and hypertension. More than 50–60% of the population on dialysis. Considering the home hemodialysis worldwide, it is now going up because the growth of the dialysis population worldwide, and there's incentive for home dialysis, either PD or nocturnal or short dialysis, and the efficacy of home hemodialysis is well known. We'll show on the next few slides, and mainly with less infection complication. And we know that prevalent dialysis grows over the year in the United States, in spite of the incidence are flat and the deaths are flat. So that means survival is rising. That means the population on dialysis are aging all over the world. Prevalent patient survival is rising worldwide. This picture reflects the green one is dialysis, brown one is PD, and the blue one is home hemodialysis. Mainly on New Zealand and Australia, they use more, and on Finland, and a little bit on Scandinavian, more, and a little bit on UK. Frequent home hemodialysis evolution is going up because nowadays therapy application expanded to 5 days per week. Therapy could be done either at short daily therapy or longer overnight. And a lot of all the studies, mainly we don't have randomized control, mainly observation or only selected studies which showed the benefit of home hemodialysis. We'll see later on. We have three methodology. Either perform at home 3 times a week, like in center, using the same machine we use on the center, or nocturnal home hemodialysis performed at home, absence of medical personnel, 5 to 7 nights a week, mainly on North America, Canada, they use it. And the most popular, and this is what we use, short frequent hemodialysis, 4 to 6 times a week, 2 to 4 hour, portable machine, closed system, no water treatment, and simple technique. What we use for the time being is next stage machine, with all portable cartridge and fluid. The advantage, only I said very quick, it is done all these studies in the Western country, improve renal anemia and reduction of ESA, improve dialysis adequacy, better control of fluid balance, improve BP control, less antihypertensive medication, significant reduction of LVH, improvement of ejection fraction, less cramping and hypotension, no washout after long dialysis, long-term improvement of wrist leg syndrome, improvement of muscular exercise, elimination of need of dietary restriction, improved sleep quality, cognitive improvement, reduction on total homocysteine, improved depression, improved sex hormone, improved fertility and pregnancy, improved vascular smooth muscle biology, improved patient rehabilitation, improvement in exercise duration and capacity, improvement in nutritional status, enhanced quality of life, reduction in hospitalization, increased cumulative survival rate. The unit, we need caregiver, nurse, mainly nurse and doctors, medical supply, maintenance team, backup and patient remote monitoring in case of emergency, epidemiology statistic program, finance and administration. I am going to present our experience on the Western area, which is retrospective. We start by December 2015. I think we are the first area we start in Saudi Arabia in Jeddah, and we include here two centers, Al Huda Home Healthcare Center and King Fahd Armed Forces Hospital Center, where I work for the time being. And we select 69 Saudi patients, the age from 34 to 102, the mean age about 70 years old, male to female 33 to 36. We have some patients more than 100 years old. The study was conducted for upper hemodynamically stable patient with major transportation issue, bedridden, multiple comorbidity, morbid obesity, advanced dementia, advanced mineral bone disease, and socioeconomic problem. They cannot come to the hospital. And what we used is next stage, short dialysis, assisted daily, not daily, 4 to 5 times a week. And the dialysis technique done by nurse at home. The doctor, specialist nephrologist go once a week at home. In case of emergency, patient can transfer to the nearest hospital or to his hospital who refer him to hemodialysis. Once a month, nutrition see the patient, and once monthly we do lab work, and once monthly all the team will meet together to discuss the patient quality lab work and KPI. The cause of renal failure, as I mentioned, diabetes and hypertension, the most important cause. Over the year, hospital admissions is go down, 0.5 patient per year, and this is the cause of admission infection, mainly cardiovascular problem, epilepsy, and mortality rate is improving over the year. Now we reach about 18% only mortality rate. The cause of mortality not related to the technique itself, mainly septic shock, respiratory failure, and sudden cardiac arrest and other cardiovascular. We should notice that our patient have various comorbidity, hypertension, diabetes, ischemic heart disease, atrial fibrillation, CVA, COPD, and other. The KPIs, hemoglobin, 65% of our patients on the target from 10 to 12. Concerning calcium, 85% on the target. Phosphate also 62%. We have problem on the PTH, only 50% of the population on the target. Albumin, they are well nourished patient. 70% of our patients on permacat because elderly and they don't have good access to have AV fistula, and central line associated bloodstream sepsis epilepsy is going down with the time because more infection control, and we use central line toroidine lock for prevention. Concerning KT over V, we have difficulty to have dry weight from the beginning. All 90% of our patients is bedridden. So only we have about 2 minutes. 2 minutes. 2 minutes. The patient who had weight, about 78% of them, they reach the KT over V weekly 2.1. And we give survey to the patient and the family for satisfaction, and almost all the patients and family are satisfied about the method discussion. Our project is one of the first in the region, and our approach different from the Western. The Western, they use the young people, the people who do sky, boating and traveling, and our patients more have high morbidity, bedridden or bedbound, elderly, diabetics, 70% of them have permacat. Our KPI reaches the DOPS, except the PTH, epilepsy rate is going down, mortality is going down, and most of our patients and relatives are satisfied. Our challenge, a lot of people doesn't know what's home hemodialysis. Even the nephrologist doesn't have enough experience and no orientation concerning the general population. Even in the CKD clinic, we don't propose this method to the population, and lack of patient self-confidence and efficacy, blood access complication, fear of catastrophic issue at home, lack of family member support, and cost of hemodialysis. Conclusion, less hospital admission on our experience, less epilepsy, better quality of life, better compliance and patient and family satisfaction. Recommendation, use of fistula better. If we use central line, we should make lock and improve the criteria of selection of the patient. And if we have dry weight before send patient to home, that is better for UF and for KT over V. Thank you very much.